We thought we would do this one a little bit different this time, and we would have an interview with a special guest and thermographer extraordinaire. So we're going to do that. We're going to kind of save the slides and let her show some images, but we'd really like to interview her because she's got tons of experience, and I think people can probably just pile in here as they come. But we're recording, so thanks for everybody that's here. Thanks for everybody that's watching this. I think most people here are practitioners, and that's great. So we're going to talk about getting started with a thermography practice. I'm Scott Hagedorn. This
I'm Melinda Liu.
and we've got Kristin Burton. She is the owner and operator of MedHot Infrared. So MedHot is a special company in the space. Kristen's going to get to talk about why that is and the thing that makes them special. But we'd like to talk, a little bit about her experience with her and how she built the practice and how you can do the same. So, Kristen, welcome.
Thank you. Happy to be here.
Yes. So I think right away, I just want to kind of take some of the mystery out of it because I think a lot of people that are practitioners that we work with, they haven't done this before and they get started in thermography and they're kind of wondering, okay, well, how am I going to be successful right off the bat? What are the things that I really need to do differently than what I'm doing right now or in addition to? So what are some of the things that you wish you had known right when you got started or things that are really going to make people successful out of the gate with this?
Well, I'll tell you, it's funny because the thing I wish I knew was that I don't have to know it all.
Yeah.
And a lot of times I think people think, oh, if I'm going to be a medical thermographer, I have to be, really knowledgeable about, patterns and seeing all, the temperature differentials and everything. And what I realized was I needed to take the best framed, focused, and colored images I could, and then let the interpreting physicians do their job. And I was so into like thinking I had to know it all that I stepped in my own way a little bit. But then I kind of calmed down a little bit, and I'd be happy to tell you my story if you'd like to know how I got started.
Yes.
So, I was a wellness coach for many years, went to college for pre-med and medical technology, and then I grew up in a holistic family. So I'm like, this is not working with me. It's not resonating with me. So what I did was I finished college, but I went into Clayton College of Natural Health. Does anybody remember that organization? And I just started taking classes from them. And then I became a wellness coach and got some certifications and all that good stuff. And I worked with Dr. Carol Chandler, who founded MedHot, and I would always bring her to the spa that I worked at, and she would do the October Pink event. And one day, Dr. Carol said to me, you know, thermographers aren't really all that pink. Would you mind not doing pink next time? And I'm like, sure. And she said, would you like a job being a medical thermographer? And I hesitated for less than half a second and said yes. And the rest is history there. I started working for Dr. Carol Chandler, and I realized when I started working with her that she's like an international celebrity in the medical thermography space. And I didn't realize it, but wow, she is, everybody knows who she is worldwide in the medical thermography community, and I got to work with her for the past 15 years. So Dr. Carol and I have been together for almost 20 years now because I was her patient beforehand. And so I started my medical thermography business working for Dr. Carol and then went on my own, but still working for Dr. Carol and training for her when she sold camera systems. And like I said, I wish I knew that I didn't have to know it all, but it was a very simple process. I forged relationships with integrative practitioners. I already knew a lot of them. And I went to their offices, just like Melinda does now, and I imaged in their offices. And I would, help them with little like open houses and things like that. And my schedule was full. And I expanded to 26 locations across the state of Florida. And it was a lot easier than it sounds because I was in the middle. I had about an hour range around me. And about 3 days a week, I would go and spend a day at an office and come home with a net profit of somewhere around $1,000 to $2,000, depending on my day. And it was a great way to connect with people, to be doing the good work in the holistic space, and also a very profitable business. So here I am today, 15 years later. Dr. Carroll calls me and says, I'm 81 now. I think I'd like to sell the company. Would you like to buy it? And so I bought the company 2 years ago. And now, with the help of Scott and the support of Melinda and others, MedHot is still the best of the best. And I'm so excited to be here in the thermography space as the premier camera integrative system in the world.
Thank you for that. Yeah. Do you mind if I ask you some like real detailed questions about the business side of thermography?
Sure.
Because I know that people listening may be interested in either just bringing it into their practice,
Mhm.
or they may want to be a traveling thermographer and just have this be, something that they do in addition to, or, if they're interested in just doing something totally different from having their own office or some kind of hybrid. Actually, I actually like to have kind of a home base office that I work out of, and then I also travel to different doctors' offices. But what kind of practitioners do you think could incorporate thermography into their business? Like, what type of practitioners
Mhm.
did you work with in these 26 locations?
I had all the integrative community, the whole wheel. I had the chiropractors, acupuncture physicians, two health food stores, which was great. I love doing the health food stores. Um, Always had a lot of business there. I had a couple of integrative MDs, or more than a couple, about five of them. And then I had wellness coaches who would rent a space, and then I would go into their rented space. I rented my own space, and that's a very underutilized way to do it. I would rent one of those office places for a day and get like a medium-sized one for, I don't know, it was like $60. And I would just put the word out, to everybody that I was going to be there for the day. I'd fill it up. So I had just about everybody you can think of in the integrative and functional community. And I loved working with all of them. Each one had their own, kind of modality, and I served that well, I feel.
Why would all of these clients sign up for thermography? Like what makes someone sign up for this type of appointment?
You mean someone who wants to be imaged?
Who wants to be imaged? That's
Yeah.
right.
Yeah, so it started with the integrative practitioner that I was working for, that they would recommend it. Oftentimes people will find it now on social media. It's so much more widespread than it was 15 years ago,
Mhm.
and now people can find thermography everywhere. There's no more stigma on it either. Like some people thought that, is this the real deal and stuff like that. No. So a why would be that, now they understand that it's beneficial, right? And so when a integrative or functional practitioner puts it out there that they have it available, they usually fill right up because people are looking for it, and they're
Mhm.
looking for the best. And so I always, in the marketing kind of little sections of my training that I do, I always make sure that they know how to reach out and make sure that they're hosting physicians, is what we call them, know how to promote it. And then why somebody would actually want to come and be imaged? Well, they want to track their progress when they're working on various little body projects, is what I call them. I just had somebody who had and I don't do a lot of imaging anymore, so this is someone close to me. I'm pretty much helping everybody else image, but, was working on a project with her sinuses, and she
Mhm.
just couldn't stop, the pressure and the pain and everything. And we were monitoring the different treatments she was trying all along the way. And finally, we hit on one that was working, and it was the colloidal silver spray that was working for her. And and we hit on it, and then she didn't have to waste her time anymore with anything else. So why would somebody want it for monitoring? Okay, identification, evaluation, and monitoring. And then the monitoring is going to show us whether those patterns that have been identified as significant are evolving, resolving, or staying the same. And so this is a great way to practice like proactive take charge of your health. You're not waiting around for a diagnosis. You're not waiting around for a drug to work or wondering if it is working. It's a very positive way to take control of your health and kind of use medical thermography to non-invasively monitor patterns.
Thank you for that. Yeah. Um, Talking about marketing, what are
Mhm.
some of the best ways for marketing, do you think?
I got out there. Okay. So first of all, after I got my first like 5 or 6 locations where I literally forged relationships with these people, walked in the door, dropped off a packet of information, followed up. I did a few things like that. And it didn't take long for them to say, okay, I'm interested. What are the next steps? And the next step for me was to go to their office and do a couple of imagings at no charge or half price. Usually it was like the receptionist and the nurse or whoever. It was never the doctor themselves.
Hmm.
It was always somebody else. And I would image them and set up, and that gave me a good way to take a look at their location and see, is this a place where I can successfully set up my equipment? 99% of the time, I could figure out a way to set up my equipment.
Mhm.
And now we send our thermographers like little PowerPoint presentations on how do you set this up in this kind of room or that kind of room. And I would image them. And as soon as I was in there doing a little bit of free imaging, it was the best advertising time I had ever spent. You
Mhm.
will win them over right away. And the greatest person to win over is, yes, you can win the doctor over, but if you win over the nurse or the receptionist, they're going to tell everybody that walks through the door. And
That's
they're
right.
going to say, I got one. Oh, and you wouldn't believe it. They saw this or that. And so then my doctors started telling their colleagues around the state. And the other thing I did to get people in their offices was to get out into the community. So I would say to the people that I imaged, hey, if you have a ladies group or you have a church group or you want to get together a group of people, I'll come and speak. I won't charge you anything. I'll come and speak and I'll do some free imaging. I'll set up my camera. It takes what, 8 minutes to set up your camera after you get good at it. And I'll do a little free head imaging. And I used to blow up the schedule of the nearest location I had just from those little talks.
I love that. That's great.
Yeah.
Okay, I have another question about what's your conversation like with the rebooking? How do you have a conversation with the client after they come in for their first imaging, and then the conversation after they get their image from the physician's report, and then how do you talk to them about booking their next session?
Okay, so that is the most important question. And I don't think anybody ever thinks about that. They think, I'm going to be a thermographer and I'm going to do this imaging. But really, if you want to build some income, you just image them. If you want to build an empire, you image them and you make sure you get them back for their follow-ups.
Mhm.
Huge. Okay, so getting them back for their follow-ups is an expectation that you set at the very first imaging. And so you just refer to now when you come back for your follow-up, we may be able to see this pattern, I always say evolving or resolving, or maybe it's going to stay the same. So I'm referring to it, right? The whole time we're talking about things. And then at the very end of the appointment, I say, okay, so our doctors are going to give you a follow-up recommendation, especially for the breasts. And so we want you to come back between I used to say 3 months. Now we can say 3 to 6, but I always say 3. Why? Because after 6 months, they may forget they ever met you, right? So I always say, let's get you on the schedule for 3 months. And what we're going to do is all the little spots and dots and patterns that we found on your breasts, our doctor's going to report on those. And then the second one is your most important imaging because we're going to see if any of those patterns have changed. And we're not going to just hope. I'm going to teach you a simple breast clearing protocol, or those of you who are practitioners, which I think everybody's practitioner here, right? I have a protocol that, that we can do, whether it's lymphatic drainage or whether it's dry brushing or whether it's some kind of other protocol. We have suggested ones for you as well. We're going to see if any of the protocols that we've initiated here are making a difference, because we want you to have the healthiest breast possible. And when we can look at these patterns and then we can initiate a protocol and look at them again, we can see if we're making a difference. And that is why we're here. That's why you came here.
Yep.
Oh, okay. So when would you like to book? Okay, it's April 13th. So 3 months from now, it's going to be mid-July. Let's go ahead and get you on the schedule. Hey, if you have to change it, call me. We'll just reschedule it. Don't worry about it. You might, yeah, I might be on vacation. That's fine. Let's just get you on the books. Get them on the books. And then that's how you build an empire.
Mm-hmm.
Right there.
Well, that's a great segue because I would love to see some before and after images
Mm.
of just, yeah, what does it look
Yeah,
like when someone can actually change?
right.
Or just really let's look at some images because if people who are new to thermography on this
Sure. Yeah, I've got
webinar
some
would
fun
like
stuff
to
to show you.
look at some
We
images.
have some before and afters, and we also have some within and beyond range of accepted intensity. So let me show you what I'm talking about. Here is somebody, this is a before and a during, which I love. So here's the before. Can everybody see this?
Yes.
Okay, so she came to us and she was having the worst digestive discomfort. And when we took a look at her, we knew why. This pattern here with all these little dots, this pattern is called mottling. And then you see that cold spot right there. Wow, what's that doing? All these little dots are like hovering around it here. So that we train you to ask questions about their gut when you see this. I know you haven't mentioned that you have any kind of gut issues, but it are do you is there anything that's going on? And then I say the words first. Diarrhea, constipation, anything going on like that? And they're like, yes, because there's no way somebody looks like this and doesn't have something going on, right? So, yep, this poor woman. And she went on a great protocol by Dr. X. And she came back to me a while later, and she was looking like this. Now, this is a huge reduction and resolution of pattern. Huge. We teach you how to take these images properly so you're giving them a correct and trustworthy comparable image too. Well, what she was doing was she was doing Dr. Axe's bone broth protocol, that she was doing the GAPS diet and all kinds of interesting things. But look at the difference on the laterals too. I mean,
Mhm.
this is huge. So I wanted to get her back for the after, but she was feeling so good. She canceled her appointment, and I talked to her on the phone. I said, I really want to get an image. She goes, I feel so fabulous. I'm not coming in. I'm Dr. X did his good work on me. I'm like, okay, but she looked so good, and I was very proud of her.
Nice.
Let's see, not that. Let's see. Here we go. Can you see this beyond within accepted range and beyond accepted range for intensity?
Yep.
Okay, so this is another type of way we show people how important medical thermography is. So when we image, this is a male, and we image their chest, and you can see the different palettes that we use. We have about a dozen of them. This is what we'll train you in, which is really simple to learn in a palette like this. And then we put you in a palette like this, and then these are the overlays. They're optional. They don't always go on, but look at that. That's patented right there. Nobody else can put that on their images. And we've got the bones, and we've got, let me see if I can make this even bigger for you. Okay, so this is within accepted range for intensity, but look over here. You see this dark spot here depicted in blue and blue down here. This on the left side of the chest, everything's backwards, so your right is actually their left. this may indicate that the heart is struggling for blood flow, for proper blood flow. So sure enough, we can see this. And when we send it into our interpreting physicians, they'll report on that legally. Now, I got to tell you this, there's a lot of companies out there that are not operating legally and FDA compliant when it comes to describing patterns like this or describing what medical thermography is. We are absolute sticklers about FDA compliance. Okay. So anyway, this person here had a CT scan, a calcium scan, and yep, turns out those were some clogged arteries right there, the coronary arteries. So important that the work we do is so early that this person wasn't feeling chest pain. There was no event, there was nothing. We really, really are so privileged to be able to show people this indication that they can get on top of with diet, exercise, supplementation, lifestyle choices instead of heart drugs and catheterizations and heart attack events and things like that, which are surgeries and bypass and stuff, which are oftentimes, if you wait, what you end up getting.
Mhm.
50% of all people who have heart disease find out from their first heart event. Interesting, right?
Mhm.
Not the best way to find out.
Not the best way to find out. Okay, here's one that I think is interesting here. Let me pop this up over here. Oh, doesn't want to move. There we go. So this person comes to us. She's having gut issues, as you can see here. And she is overweight and she can't lose weight. So check the thyroid, check the thyroid. There's a little warm thyroid up there. Okay. She got her report back. And remember, you don't have to be the expert. I'm 15 years an expert, but you don't, all you need to know is to ask the question. Let our doctors do the rest. This is a very simple business model. You do not have to be some expert in patterns or anything. You'll get to know them as you go through, but not to start a successful business, you don't need that. So I asked the question, she was eventually diagnosed with celiac. And when
Mhm.
she got on top of the celiac, let me see, can I make this bigger for you? I think I can. You see that? When she was eventually diagnosed with celiac, she was able to make some changes. So, you ready for this? Let me pull this one over for you. This was her less than 6 months later after she stopped eating wheat and was really very, very much on top of the celiac, changed her diet, also did a lot of mental type stuff too. And she lost 30 pounds and looks so much better. All that mottling, all those little polka dots around. And is anybody wondering what this is right here? That's the liver area right there. And she was doing a liver cleanse at the time. So you can see that the liver is kind of lit up, getting rid of its toxins. Kind of cool, right?
Mhm.
So there's a few little befores and afters for you.
Thank you.
Hmm.
Um, let's see. Can you tell us, I'm the business coach. Can you tell us how much money you were earning at the peak of your thermography career and how many hours were you putting in for that type of income? Like, what did a typical work week look like for you? Like, how many sessions were you doing?
Well, I had kids. I had a life, a husband, a couple of dogs, like to go traveling. And so I was putting in about 3 days a week of imaging. And I was promoting, through my social media and things as well. So I usually had a full day of imaging, and the full day of imaging is like 6 to 8. And I felt that was really a healthy day. And I was making about $160,000 a year
For 3 days a
for
week.
3 days. Yeah.
which is, basically like super part-time.
Yes, yeah. And those other 2 days, I really didn't have to work. Sometimes I would, but those were days for fun. And then when my husband retired, he retired early. So once he retired, we got Disney passes and, went to the beach and did fun stuff. And yeah.
Yeah, I love that this is a part-time six-figure income.
Yeah,
Because a lot of people will work a lot of hours to make six
yeah,
figures, and thermography, you really can do it in a couple of days a week, which is amazing. And so
yeah.
even if people are adding this to their practice, they can add an additional six-figure revenue stream to whatever they're already currently doing. Because it doesn't take that many sessions to get to those numbers. If you can just add like 12 to 15 appointments a week.
Yeah.
Yeah, that's not
And
that many.
as I'm working, I'm always curating the business to make sure that it is sellable. Because when the time came, I sold that business for a lot of money. And the gal who bought it was ready to start, and I was ready to slow down a little bit. I and haha, buying Med Hot, I didn't slow down that much. But it's such a joy. But so she took the business. She took the 26 locations I gave her and built them into 60.
Yes, she
Yes,
did.
that's June. That's June. And talk about six-figure incomes. I don't know. She hasn't shared with me, but if you triple mine, because I know she's busy. I know
Mhm.
she's really busy because she's doing quite a bit. Now, she has an assistant now. So when you get to a certain point where you're at empire level, right? She hired my assistant when she bought my business and she keeps her busy. So now it's so wonderful. She's making great money for herself. She is now taking a step back and only doing 2 imagings a week. And she's got my old assistant, Gina, doing 3 days a week. And Gina is making a good income. And she now provides for another person, which is like heartwarming, right? And she's now curating the business to sell probably for millions. So, I
Yeah,
mean,
I love that. That's like not that common actually in massage. I'll just say that.
yeah,
Um, Unless you have a multi-therapist, practice, but
yeah.
typically solo therapists can't do that generally. I mean, it's not impossible, it's just not common. But in thermography, it is common for
Mm,
thermographers to sell their practice or their book of business to an
right.
upcoming thermographer when they're ready to retire, let it go.
Yeah, yeah. I
Yeah.
every time I talk to June, who bought my business, she always says, "My goodness, that a win-win or what, Kristin?" And I said, "Absolutely. I've never looked back." And she goes, "All I'm doing is looking forward." And we are just, every time we get together, we hug. So it was like a beautiful thing all the way around. So always be building your business and curating your business to someday when it's time for you to take a step back, or maybe even just hire somebody else so you can take that big step back. Always be thinking about that. And we help you. People call me all the time and brainstorm that kind of thing.
I love that.
Yeah.
That. Okay, maybe we can open it up for Q&A from whoever is watching.
Let's do that. In the meantime, I'll ask another one. When it comes to the equipment and the training, we didn't go into too much about MedHot yet, Kristen, but maybe you could just outline the key areas. What's important for people when they shop for a system and for a training program? What do they need to be looking at, and why is MedHot exceptional?
Right. Yes. Well, we've been around a long time, so we know what it means to be the best. And we know what elements need to be in place in order for thermographers to be successful. We're not just trying to sell you a camera, train you, and leave you. And so building that relationship, I think, is something that's really important, and nurturing every single one of our thermographers, and helping them when they need help. But just on the real basic side, we have the best camera system in the business. We have FLIR. And FLIR is, they were just up there with the astronauts, with their FLIR cameras up there, and really exciting. It's an $8 billion company, and we are so proud to be their exclusive medical integration partner. So you want a good camera? We've got it. Trust me, we've got double the warranty of anyone else in the business. So when you're looking for a camera, if it says FLIR on it, check. If it doesn't, now you've got to ask questions about what is your warranty? How long is the life of this camera? Will I still be able to get repairs afterwards, after 5 years or so? And that's a lot of reasons why people come to MedHot too. They say, I had a camera for 6 years. I was doing pretty good, but it's not the best, but the camera died on me and they won't do anything. They can't fix it. They can't do it. So important. The other thing that's important is it a turnkey business package, or are you going to have all of a sudden have all these add-ons? So ours is turnkey business. We're not going to charge you a monthly fee to be part of MedHot. We're not going to drain you every year for some big membership fee that doesn't mean anything. You pay for your camera, and then you're now, an independent business owner. We don't keep trying to reel you in with fees, but we're always here for you. Um, when you're looking at an actual camera system, look for a really awesome software that helps you position your clients properly and helps you make true and comparable images. Because the number one highest and best use of medical thermography is true and comparable images over time with consistency. Nobody thinks about that. MedHot's taken a lot of time to think about that, and we created a patented software that nobody else can touch, that really helps our thermographers create those amazing images. I think a couple of things to look for that you would never think to ask about is, do you have autofocus? We just found out that we're the only ones. What does that mean? How do they focus? Scott, we still don't know how they focus, right? They
No,
have to reach
you gotta
over and
turn them, and
twist.
you gotta move the patient or client back and forth
Oh,
and move the camera, and it's just not a great experience.
it
Yeah.
turns your imaging experience into a circus, is what it does. Because I've watched people image when they don't have focus, autofocus. Also, zoom, being able to simply having zoom to bring people closer and farther away without having to physically move them. You will look and appear so much more professional when you're imaging with MedHot software. The other ones they're just yakking all the time. Come a little closer, move backwards, stop. And the other thing that we promote is, and we teach, is privacy imaging. Privacy, I think you discovered that, Melinda, how refreshing that is.
Well, I, as a massage therapist, have had to make people feel comfortable being undressed. Well, although they were under the sheets, they were still undressed. So I started with a different company just to, we're talking about how great MedHot is, and I'll just say that I was with a company that was not great to start, and we weren't trained to do privacy imaging. So it was awkward. I mean, some people are more bold than others being undressed, but some people are actually really mortified being undressed in front of somebody, and just to be out in the open, just standing there. So I will say it does definitely add a level of comfort with the privacy screen. Just everything moving into the MedHot space has been such a professional upgrade, much more like a wonderful experience for me as the thermographer and for the client experiencing it. Just everything has been like, yeah, an upgrade, a true upgrade, and I'm so grateful.
That's great. We do hear that a lot from people that come from other companies, that, just this, like you said, professional upgrade is so, helpful to them in creating more and more clients, because people used to say, well, why should I go with you? The other company is $5 less. And I'd say, privacy. I would just tell them a little bit about privacy. Done. They were with me. Or I would also lean on my camera. I'd say we have FLIR cameras, and other people say they have high resolution cameras, but we don't just have high resolution cameras. We have a high resolution connection to the software, which you can have all the high resolution you want in an amazing camera, but if you don't connect it properly, you're not going to. So little things like that that you would never think to ask. When we can give you a list, if anybody's shopping, we'll give you a list of questions to ask. But you're going to come back to MedHot and realize that we have absolutely every box checked in the premium imaging space, except for the price, because our price is the same as everybody else, sometimes a little less, sometimes a little more, but not much different. You're getting a premium product, and we have been able to make it affordable, especially when you look at the value of it and everything that you get, and that you're not paying. I don't know, some companies are charging $200 a month just to use their name. I don't know even what they're paying 200. They don't either. So when you start adding all those numbers up, we have a great price and a great value.
Can I just brag a little bit about some of the people that you have had reached out to you interested in MedHot? You've had professional sports teams, you've had some universities, you've had several people wanting this for research, scientific research. Even someone today was calling from Germany who is a practitioner who does some type of specialized healing, and they wanted to monitor their treatments with their patients, right?
Right. Amazing, amazing what they're going to be doing.
Yeah,
Yeah.
it's actually, I think it's massage based, the protocol, but they're functional practitioners and they have a protocol that helps with emotional health. And they've studied emotional health related to how it affects the blood and the blood perfusion in the actual organs. And they're getting great results with this one particular protocol. And so they pretty much know that thermography is going to be the best way to monitor that. And they want to open a clinic to do that. And they're going to open a clinic in the US, all the way from Germany. So pretty exciting.
And I
Yeah.
just was, Scott and I were back to back today with people that were interested. I just talked to some people that are putting together an entire holistic clinic in Virginia. And I was talking to two doctors and a thermographer that comes from another company that says, I don't want to bring my other company into this new space. I want MedHot. And I was like, I'm honored. What can I do to help you? And so I had a fantastic chat with these two doctors. And at first, they had one budget, but when I helped them understand the value
Mhm.
of what we offer, they're like, "Oh, this is amazing!" And I think we're going to have a whole holistic, a big, beautiful holistic presence in Virginia. And then they want to open up 6 other clinics. So just words getting out there that thermography needs to be a part of every holistic practice. So if you're a medical thermographer, all you need to do is let the functional people in your area know that you do thermography, and they'll want you. I
Yeah.
mean,
Yeah. That's really starting to happen for me now too. And
yes.
I just want to say, I think this is such a great way to monitor really any type of healthy lifestyle change, whether it's a treatment or whether it's a product. And I follow this one thermographer, Joanna. She has a lot of before and afters on her Instagram. And you can see really simple changes. Like one woman, she just convinced her to stop wearing toxic body products like lotions and deodorants and like perfumes with all the phthalates and BPA's and just, horrible toxins. All she did was get her to switch over to clean products, and she was able to do a before and after thermal image. Um, and another woman got someone to stop drinking coffee for a couple months, and she'd had a before and after thermal image. So what I'm trying to say is that anything that can create even a small healing response in someone is going to show up on a thermal image, whether it's massage, whether it's acupuncture, whether it's chiropractic, whether you're getting someone to stop drinking alcohol, caffeine, switching out their body care products. I mean, any amount of healing can be revealed by this thermal imaging camera. And so, if you're a practitioner and you feel like you are creating a healing response that which would lower inflammation in someone's body, you can monitor that. But there's product companies that are also wanting to share before and afters, whether it's like supplements or frequency therapies or grounding products. So everyone wants to show that whatever the service or the product is, you can see the reduction in inflammation. And it doesn't take that much. You don't have to like perform miracles to get these after images.
Great
You want to
point.
see something? What you said?
Sure.
This is getting rid of aluminum deodorant
There you
and
go.
lymphatic drainage massage before, after.
Love it.
Isn't that
Wow.
That's an
amazing?
enormous difference.
Right? And I used to see this all the time. And I used to love to work with massage therapists because they could get this job done quicker. Because they have them, stop the aluminum deodorant and go to there was in 15 years ago, 10 years ago, there wasn't a lot out there in terms of non-aluminum deodorant. Now it's everywhere. But the lymphatic drainage massage therapist really knew how to get this job done fast too. And
Mhm.
look at the difference. Isn't that wonderful? Now,
Yeah.
what can we say about this? Can we say that they're not going to get cancer now? No. What we can say is your breasts look thermally healthy, and we believe that thermal health is extremely important to the health of your overall health of your breasts. So, isn't that cool? I
Yes.
have
I love
tons of
that.
these. I have tons of these. And that's one thing that's kind of cool too. You guys are wanting to do your social media and we make all this available to you. So you
Yeah.
don't have to get your own well, use ours while you're creating your own.
Yeah, to show before and after is just compelling for, before and after weight loss has always been amazing to see online. Before and after postural correction, seeing someone have poor posture and all of a sudden have good posture. I mean, we love visual before and afters for anything health and wellness based. And so now you can represent your work. And even energy healers have used thermal
Oh,
imaging which, if people are unfamiliar with energy healing or it's hard for them to believe the efficacy, like you can prove that with thermal imaging too. It helps to make people see like, yes, this person is getting better. The images don't lie, and it will show you a reduction in inflammation. So I just love this for really anyone in the health space at all who's helping people on any level.
absolutely. I used to love to hear from my clients, how they made a difference and how their practitioners made a difference for them. And that's huge. I used to always promote those practitioners that I would work for and say, look what so and so is doing, and look how thermography can show you with a picture. They always say a picture's worth a thousand words.
Hmm.
That's the eyes of inflammation that medical thermography gives us. Really helps you promote your business, the other forms of business that you have, your other techniques and modalities.
Yeah, I'd love to share the story I told you earlier about thermography client. It's like my most compelling story so far. Plenty of people get a heads up on inflammation at different parts of their body, and it motivates them, to work on their gut health or their thyroid or their chiropractic care, massage therapy, lymphatic drainage, etc. Well, one woman came in and on her thermal image, she had a lot of mouth inflammation and sinus inflammation. And so she chose to get further testing based on, the insight. And I guess she had some knowledge that she had some breathing issues. She had a deviated septum and always had some sinus issues. So it wasn't surprising to her to see the sinus inflammation. But when she saw it, she felt compelled to actually do further testing. And so she went and actually got sinus surgery and corrected her deviated septum. And, her sinuses looked so much more clear on the next thermography. Well, she also went to the biological dentist and said, my thermography showed that I have some mouth inflammation. I know I have root canals. Can we just do like a cone beam scan, which is like a deeper scan? And they did it, and they found that she had a very severely infected root canal. She had no symptoms, no pain. She never would have known that she had a severely infected root canal if it wasn't for the inflammation showing up on her thermal image. So she had that safely removed and taken care of, and they used all the ozone therapy and all of that to make sure that she was really clear and the infection was gone. So to me, that was one of the best stories because I don't know if you guys have seen the documentary Root Cause, but an infected root canal is almost guaranteed to lead to some type of major illness down the road. It will really wreak havoc on your health. And this woman was in her mid 40s. She's got young kids. So it was such a relief for me that, oh my gosh, I'm so glad she took care of that because that would have really progressed into some horrible health issue down the road. And she did take care of it. And that's where this is in the preventative category. If you catch something early enough, you can fix it quickly. You don't have to wait till late stage, like you said, with the heart attack.
Right. Absolutely. You were talking about that root canal. 50% of women with breast cancer have a root canal on that same side,
Mm.
which is a chilling fact. And more biodentists are interested in medical thermography, more
Hmm.
and
Yep.
more. So,
Yeah.
because we can see inflammation long before, like you said, she had no idea she had a severe root canal infection. But you know what? You know what knows? All of these lymph nodes right here.
Mm.
Anytime somebody has an infection in any kind of tooth, these lymph nodes down here are busy,
Yeah.
very busy, very hyperthermic. I don't think I've ever seen one hide from us. So,
Yeah. Yeah, I have also seen a woman who had she was in a car accident, had severe whiplash with her neck. You can see injuries. It was like very inflamed around her neck and upper right trapezius. A guy sprained his ankle pretty bad and had some kind of, he also had like rheumatoid arthritis. A young guy actually with rheumatoid arthritis, but you can see his inflamed joints. Um, I definitely see neck pain and back pain all the time. As a massage therapist, I always felt that in people's body. As a thermographer, now I see the neck pain and the back pain all the time. So again, it's really compelling to see it on an image for clients so that they can um, visualize it, even if they feel it, or sometimes if they don't feel it, a lot of times people can just be inflamed and they've just learned to live with it or they've just gotten used to a certain type of dysfunction in their body. So I think it helps them see like we really want to work on this, right? Like we need to work on this. Your body needs help. Chiropractors do this. They show you your x-rays and how out of alignment you are or how fast your discs are degenerating and then they put you on a treatment plan. Let's look at this image here with a client, and it's like, let's put you on a treatment plan for this. We don't want to ignore this. Your body is like screaming out to you.
this if pinched nerves and necks, this one right here, that when you see that cold spot right in the middle of what should be just all one color, boom. And oftentimes, this is the first indication that there's something going on right here. So we have all kinds of great images for, the holistic trade in terms of body work.
Hmm.
We should point out too that these images look different, like different scales, different palettes, because there's a lot of different palettes
Mm,
in the software to choose from. So that's why they look different. But typically, this rainbow palette here is the one that is used most medically. But you can look at it a
yeah.
lot of different ways, which is helpful.
Hmm.
These are lungs, by the way, just in case anybody's wondering what we're looking at there. Those little points, that's lungs. And this lady had a big issue with her lungs, and she smoked 3 packs a day. So, and here's your generalized inflammation of the upper back. I know you guys can all feel that with your hands just looking at it, right? A lot of people say, as soon as I get around somebody who feels like who tells me that they have inflammation, my hands want to touch them. That's those energy workers that we work with a lot too. So thought
Mhm.
maybe I would put some images up as you were talking about that kind of thing.
Yeah, thank you. Exactly. That's exactly what it looks like. So yeah, again, if you guys have any specific questions, feel free to throw them in the chat. Otherwise, I think we have really covered a lot of the, practical thermography applications and how it can be really versatile for different types of holistic practitioners, and even in business it's versatile. You can just include it in the practice that you already have, or you can become a traveling thermographer. Um, you can partner with other doctors.
We
Lisa.
have a class, by the way. So a lot of times we teach them how to use the equipment and how to take good images, and then we teach them how to go mobile. And so you don't we don't ever throw you to the wolves. We've always got, something that will help you move forward when you want to take that next step.
Lisa wants to know if there are any images of a spinal bursa.
Hmm. I don't
Probably.
think I have any, but I could get some for her. I could send it to you.
What? Okay, we'll move on to the next one. What do people, what's the most commonly requested image, or what's the most popular appointment?
Breast imaging because that's what they know medical thermography to be. And it's up to us to help them understand. We do full body thermography as well. We image the whole body. And then I'd pull up my little thing. Look, we can image the head and we can image this and that. And what? And I'd say, yeah, you're paying $200 or $250 for your breast study, but for another 100, I can do another 6 regions of your body: the head, the
Mhm.
abdomen, the back, the neck, the lower back. And oh, okay. Well, yeah, I can upgrade to that. And I almost always upgraded those breast people to a woman's health study, which is head to hips.
Yeah, look, I mean, the story Melinda just told, she wouldn't have known if she just did the breast study, she wouldn't have seen the dental infection because that wouldn't have been included. So all these things are connected. I think everybody here probably realizes that
Yeah,
it's a complete system, and if you're looking at the full body, it's just a way better picture of health. So
indeed.
Mhm. Why is thermography so heavily marketed for breast health?
It's how they started out. It's how they started out 40 years ago with those, you know, 15,000 pixel cameras.
A lot of
It,
the
it,
research was done on thermography with breast health.
right.
Yeah, that's right.
Early on, 5,000 years ago, they used to spread a thin layer of a special kind of mud over the body and watched where it dried the fastest. Boom! And it gave a
Prehistoric
great picture.
thermography.
5,000 years ago, people say, how old's thermography? Like 10 years? I'm like, 5,000? I don't know. When, tracking heat on the surface of the skin, that's not old, that's not new. But the way we've refined it and how we've gone from just 20 years ago from 19,000 pixels to 307,000 pixels of high resolution imaging, we've come a long way and we got miles to go. We're so excited for the future of medical thermography.
Okay, we got a couple more questions. So Yafia wants to know, hi Yafia, how do traditional healthcare practitioners react to thermography? And have you had good relationships with practitioners? Do they send referrals? Yeah, is it more holistic practitioners, or have you had any like traditional Western MDs become involved, or nurses?
The nurse practitioners are the ones that we really see a lot coming from the medical world. They come in droves. I would say every third training I do is a nurse practitioner these days, whether it's some of our established clients bringing in new thermographers or brand new people. So on the medical side, I just always make it my mission to just help them understand that we are not trying to diagnose. As long as they know we're not trying to diagnose, they're fine. But they don't know this. About 20 years ago, medical thermography tried to get in on the diagnosis train, and the FDA said no. So some people stuck with that and clung to it, and other people said, we don't want to diagnose anyway. Why would we want to wait all the way until there's something to diagnose anyway? We're the eyes of inflammation, the first spark of any disease process. We're not interested in diagnosing. Let's help people tweak their health along the way and help healthy people stay that way.
Before the diagnosis.
Yes.
Okay.
Yes.
Someone now wants to ask, oh, we got lots of questions now.
Woo.
Um, okay. She wants to know, what is the cost of the equipment and the training included?
The training is included in your overall cost. We have a high value to our package. And if you're interested in knowing, I'm sure Scott can send you a quote where it puts everything in line for you, the training, the camera, the Pelican case, the computer. You can literally open up the box, right, Scott? I'm stepping on you here because
Go for
this is
it.
where you you can literally open up the box and start imaging. 10 minutes later, it's a complete business turnkey package. And it's Scott, you want to go over prices?
Most people tend to finance the equipment, not always, but their payment is generally between $500 and $800 a month, sometimes more if they want to pay it off faster. So we have two systems. They're totally inclusive, like Kristen mentioned, business ready, includes the training. This is something you invest in basically one time and you're good. If you take care of your camera system, it's going to last you a long time. So we have two different resolutions. They're both very high. The highest one is 30,975 for the entire package and the training. And then there's another one. It just gives you another option. It's just barely lower resolution, and that one is 27,300. And yeah, most people tend to finance them, and it really is just the cost of doing two appointments a month in order to make the payment. So it's pretty doable.
Yeah, I would say that based on the way I used to image, my 1 day a month would cover my camera payment because I had to make
Yep.
one too. And then the rest of the month was my money. And I'll show you something here. The people I talked to today, this afternoon, this is the camera they were working with. So look at this, look at the difference in resolution. This is 19,000 pixels of just little blobs of nothing that pretty hard to even measure. And then here's MedHot with ultra high 307,000 pixels of resolution, along with all of the cables and the resolution of and the software that help this be the best image that it can be. So look, we can see shapes, we can see temperature differentials. You can hardly see anything over here. And this is what these people are imaging with today. The gal I talked to does hundreds of images every couple of months, and this is her camera.
Mhm.
And so when I showed her this, she just about fell over. She's like, I didn't think that was possible. Yes.
I know. It's so much better. It's amazing.
Yeah.
Okay, we still have lots of questions.
Oh boy. Okay, let's go. Rapid fire.
Do you have to purchase liability insurance or what kind of insurance?
Oh, in most states, you do not need to have medical liability insurance because you're not diagnosing anything. You're not taking care of anybody in terms of like the diagnosis part. So for medical thermography, your regular business liability insurance, which I used to pay like $100 a month for, if that, I think I'd started out at 50 and went up to like 90. That's all I
Okay.
need. I didn't
Okay.
need medical.
How many images are taken for a full body study?
It's a 36,
Okay.
quite a bit.
How long is the training and the cost of the training?
It's included in your camera system price, and it's an 18-hour training, 3 6-hour days.
That's it. 3 days and that's it.
Seriously. Yeah, and then we have a lot of extra training. We'll get you started, and then you have lots of extra training that you can get through the IAMT, and we give you a free membership for your first year to the Institute for the Advancement of Medical Thermography for business and educational support.
Yeah. I'll just say this is the easiest money I've ever made. You're really just a photographer. You have a camera, you take pictures of people. It's for medical purposes and If you can take images, then you can be a thermographer. It's really not hard at all.
Has anybody asked about interpretation yet? Because that should be one of the first questions you ask.
What is
They have
what
not.
is interpretation?
Okay, so interpretation is when you take the images, but remember, you don't have to be the doctor. With an easy upload from our software, it goes into a portal and you have an MD, a DO. We have about 11 um, doctors who are interpreting for us, and they put together the report, not you. And you really want a quality interpretation service that follows FDA guidelines, which we do to the right down to the, the stickler words that we use. And we turn them around in about 3 to 5 days. That's huge. And that's a question that everybody should have on their mind. And do you have to pay extra to be a part of that? No, in MedHot, you only have to pay for the interpretation. So if you charge $250 for a breast study, 58 of that is going to go to interpretation, and you get to keep everything else.
That's right. We should talk about the interpretation prices.
Yep.
So, the breast study is $58. Normally we charge $250. I charge $350 for a women's health study. That's the half body, head, neck, torso, and breasts.
Mm-hmm.
And the interpretation is like 93 on that, I think, right?
Mm-hmm.
And then the full body I charge 450, and the interpretation on that is 133, I think.
133. And that's as many images as you can send. So if you want to add in a special foot study or the hip study, you'll never be charged more than that. So that could go all the way up to, 60 some images.
And the time frame on those studies, I can do a breast study in like 15, 20 minutes.
Mm-hmm.
I can do a half body study in about 30 minutes, and the full body is about 45 minutes.
Good for you. Yeah, you're doing well.
So it's not time consumptive. It's actually a pretty quick appointment, assuming that they don't have a super long health history intake, with like a lot of things going on with their health. But even so, you can get it done definitely well under an hour.
Mm-hmm.
So yeah, I feel like we've answered a lot
Did
of
everybody?
questions.
So the
Um,
cost is 27,300, somebody asked.
that would be closer to the A500.
That's
That's
the
the
A500,
A500.
yeah.
Yep. And the
Yeah.
A700 is going to be 30,975.
Mhm.
And
I
there's
really like, go ahead.
just a slight difference in the amount of resolution. Not much at all.
Yeah, I could show you the difference in resolution if you want me to find that, Scott.
Sure. I
Okay.
have trouble telling the difference, honestly, but
Yeah,
some people just, like they opt for the lower one. It doesn't happen a lot.
let me see if I can find that. I know it's here because I just showed it to somebody today.
Yeah,
There it
Scott,
is.
what's the amount per hour that a thermographer earns?
Generally in the 400 to 500 range per hour.
400 an hour? Yeah,
Yep.
it's really hard to find any other practitioner earnings that can even compare to that.
With a 3-day training.
With a 3-day training. That's
You got,
correct.
you know what? If somebody goes to school for 6 years and then interns for 7 years, they can make $500 an hour.
That's
But
right.
that's my big one. Okay, here's our A700. You can see some amazing detail. And here's the A500. And really, I mean, I have a trained eye, yes, I can see the difference, but I guarantee you your clients will not see
They
the
will not.
difference. And
No.
this is still better than 90% of what's out there because even if somebody has the resolution of an A700, they don't have the cables to transmit it to the image. They use USBs. They don't use Cat 8 cables like we do. I know that sounds a little nerdy, but you're going to get a better image from our A500 than you would from their equivalent of an A700 if you're shopping around. Um, so, but what's the most important thing? can our interpreting physicians interpret this one just as well as this one? Absolutely. Dr. Carroll and all the physicians say when it comes to temperature differentials and the measurements, we're not handicapped with the A500.
Right.
So most of the thermographers out there in the world are imaging with, if they're happy and lucky, about 76,000 pixels. The A500 is 161,200 pixels, and the A700 is 307,200 pixels. So these are both premium cameras at the same price as what you're going to pay for their, you know, other people's cameras that are a little bit less in quality and professionalism.
Yes. And I just want to mention when I send the client the report from the physicians, I personally just offer a free consultation call if they want to go over it
Mhm.
together. And I basically just read the report to them. There's always a bold section, which are the takeaways of the report or the thermographic findings. And then if they want me to refer them to a biological dentist or a chiropractor or a massage therapist, or maybe I will be their massage therapist, then you can make referrals if you have referrals to help them resolve these thermographic findings, or maybe you are the practitioner to help them resolve these findings. But it's nice for them to get the report, see what's happening, and then have some kind of direction on how to improve these findings, whether it's through you or referrals through you. That really that makes the whole value of this better if they can make sense of, I have this image. Now what? Now what do I do with this image? And then the excitement, I try to get them excited, like, okay, you need to get to work. You need to go improve your health, and then I need to see you back in 3 months or 6 months, and I want to see how great you did. So I'm always encouraging them, like, whatever we see on these images, we're going to have a proactive mindset that we're going to improve these inflammation patterns because sometimes people are afraid. I'm afraid of what it might see, or my whole body is going to be red. I already know I'm inflamed. And so sometimes people have an apprehension, like, they think we're going to tell them they're going to die or something. And I just try to like switch that mindset around, like, we really need to know what's going on, and whatever we see, there's always room for improvement. And I personally believe that anyone can heal at any stage. I don't care if it's early stage or late stage. I've seen people heal from all kinds of things. And thank goodness we have the internet and all these Facebook groups to show that people are healing all the time from all kinds of things, whether all the infinite variety of pathology that humans can express. Like, healing is always possible. And so I try to encourage people to take that mindset when they're looking at their images.
Very nice. Well said, Melinda. Yeah, you know what's nice about you? You can just hear your healing heart,
Yeah, I mean, that's the point, right? Why are
isn't
we
it?
why are we
Yeah.
doing this again? We're
Why are we
supposed to
doing
be
Yes.
this?
helping people. Yeah.
Yep, we're helping people because the heroics happen on the other side of the fence. You know, the doctor went in and removed the thing or fixed it or whatever. And on the side where we're proactive and preventive, we don't always get that, that heroic type, thing. But we do so much good work that nobody even knows we do.
Mm.
Right.
Yes, I'm sure everyone on this call has
Oh,
lots of
you know it.
wonderful testimonials and reviews, and it's just between them and their clients mostly.
Yes, Michelle. So it is generally a cash business. People pay out of pocket most of the time. There are a lot of HSAs that will cover it, but that's generally what happens.
Yeah, HSA and FSA, people can use those cards.
I see something where someone said, so it is 8,500 including 3-day
I
training.
think she thought we were saying 8,500 when we were saying A500.
Oh,
So yeah,
A500.
we have
Oh,
the A500, which is the 27,000, and the A700, which is the higher one, 30,000.
yes.
Yeah.
Yeah, it includes the training, and also the support. You get a lot of tech support from us at no charge. And there are some people. I just found out there's one company who, if you don't take the images correctly, they fine you.
Hmm.
Hmm.
So we call them up and say, hey, let me help you take this better next time. Wow. I just get, sometimes I can't believe it, but we are here to support you and be part of your family and bring you into the MedHot community and to bring you into our family and support you as you go through your business. And I know, Melinda, you're a coach and you do such a nice job of supporting people. And yeah, thanks for everything you do and for the contributions that you make to the medical thermography community. It's already being felt and noticed what you're doing.
Thank you. It's been really fun, I have to say.
Yeah.
Yeah.
That's all warm in the hard zone. Any
Okay.
other questions?
Well, yeah, should we wrap it up?
Thanks,
Yes.
Michelle.
Thank you, everybody. Appreciate the questions. Thank you so much, Kristin. And
Sure.
yeah, we will have this posted and uploaded to the interwebs so everybody can see it later.
Thank you.
Have,
It's been a
have
pleasure.
have a great night.
Thanks, Kristen.
Thanks.
Bet. Bye-bye, everybody.